Topic: Is universal healthcare a viable option for the United States? Content: The debate over healthcare in the United States has been an ongoing and contentious issue for decades. While most developed nations around the world have some form of universal or single-payer healthcare system, the U.S. has maintained a primarily private insurance-based system. However, the shortcomings of the current U.S. healthcare model have led to increasing calls for a transition to a universal healthcare system. The key questions are whether such a transition is feasible and whether universal healthcare would ultimately benefit Americans. The current U.S. healthcare system, the United States, is unique among wealthy, industrialized nations in its reliance on a private, employer-based health insurance system. Under this model, most working-age Americans receive their health coverage through their employers, with the costs shared between the employer and employee. Those not covered by employer plans can purchase individual private insurance, often with government subsidies, or rely on public programs like Medicare for the elderly and Medicaid for low-income individuals. This system has several notable downsides. Firstly, it leaves millions of Americans uninsured or underinsured. According to Census Bureau data, around 28 million non-elderly individuals were uninsured in 2019, with the uninsured rate particularly high among low-income, minority, and young adult populations. Even those with insurance often face high deductibles, co-pays, and other out-of-pocket costs that can act as barriers to accessing care. Secondly, the U.S. spends far more on healthcare per capita than other developed countries with universal systems, yet has poorer health outcomes on measures like life expectancy and infant mortality. In 2019, U.S. healthcare spending reached nearly $11,000 per person, over 40% higher than the next highest spending country. However, the U.S. ranks 46th globally in life expectancy. The high costs of the U.S. system are driven by factors like the administrative overhead of a multi-payer insurance model, the ability of pharmaceutical and medical device companies to charge higher prices, and the fee-for-service payment model that incentivizes healthcare providers to deliver more services. These systemic inefficiencies have led many to conclude that a move to a universal system could achieve better health outcomes at a lower overall cost. The case for universal healthcare: proponents of universal healthcare argue that it would provide several key benefits for the United States. 1. Universal coverage and improved access to care. A universal system would ensure that all Americans have access to affordable, quality healthcare regardless of their income, employment status, or pre-existing conditions. This would help address the problem of the uninsured and underinsured, and reduce financial barriers to seeking care. 2. Cost savings and increased efficiency. By eliminating the administrative overhead of the multi-payer insurance model, negotiating lower prices for drugs and medical services, and moving away from fee-for-service payment, a universal system could achieve significant cost savings. Studies have estimated that a single-payer system could reduce national healthcare expenditures by around 10–15%. 3. Improved health outcomes. With universal access to preventive care, early intervention, and ongoing management of chronic conditions, a universal system could improve population health metrics like life expectancy, infant mortality, and rates of treatable diseases. This has been the experience of countries like Canada, the UK, and Australia. 4. Reduced financial burden on individuals and families. Under the current U.S. system, many individuals and families face the risk of bankruptcy due to unexpected medical expenses, even for those with insurance. Universal health care would eliminate this financial risk and provide greater financial security. 5. Support for entrepreneurship and job mobility. Employer-based insurance ties workers to their jobs, as leaving would mean losing coverage. A universal system would decouple healthcare from employment, freeing workers to pursue entrepreneurial ventures or change jobs without fear of losing coverage. The challenges of transitioning to universal healthcare. While the potential benefits of universal healthcare are compelling, the path to implementation in the U.S. faces significant political, logistical, and financial hurdles. 1. Political opposition and ideological resistance. The idea of a government-run or single-payer healthcare system faces strong opposition from conservatives and the healthcare industry, who view it as government overreach and a threat to the free market. Overcoming this political resistance would require a major shift in the political landscape. 2. Disruption to the existing system. Transitioning to a universal system would involve dismantling the current employer-based and private insurance model, which would be massively disruptive to the industry and cause significant upheaval. Ensuring a smooth transition and maintaining continuity of care would be a major challenge. 3. Financing and tax increases. Implementing a universal system would require significant new government funding, likely through tax increases. Estimating the total cost and identifying appropriate revenue sources is complex, and proposals have faced skepticism about their financial viability. 4. Preserving patient choice and quality of care. Opponents of universal healthcare argue that it would limit patient choice, lead to long wait times, and reduce the quality of care. Designing a system that maintains high-quality care and preserves elements of patient choice is crucial. 5. Resistance from powerful industry interests. The healthcare industry, including insurance companies, pharmaceutical firms, and medical providers, have enormous political and economic influence. They would likely fight fiercely against proposals that threaten their current business models and profit margins. The path forward, given the significant political, logistical, and financial hurdles, transitioning the United States to a universal healthcare system is undoubtedly a daunting challenge. However, many advocates argue that the potential benefits outweigh the difficulties, and that incremental steps can be taken to move the country in that direction. 1 such approach is the proposal for a public option, which would establish a government-run insurance plan that would compete with private insurers. This could provide a path toward universal coverage by gradually expanding the public plan and allowing more Americans to opt into it. Another strategy is to build on the Affordable Care Act by further expanding Medicaid, enhancing subsidies for private insurance, and tackling the issue of high drug prices. Ultimately, whether universal health care is a viable option for the United States will depend on the ability of policymakers, healthcare stakeholders, and the public to engage in a substantive, evidence-based dialogue and find a path forward that balances the need for accessible, affordable, and high-quality healthcare with the practical and political realities of the U.S. system.